Chairman. So we've covered a lot of territory today about the fact that the healthcare system is almost triple what it was 50 years ago when we started the conversation. Prior to becoming a senator, and it was roughly 13 years ago, as a CEO of a company that just had 300 employees, now 1,200, I could put two and two together quickly that I needed to change my own healthcare system. Always believed in covering pre-existing conditions with no caps on coverage, but my main interest was reducing healthcare costs and making my own employees healthcare consumers. I know we have two doctors, MDs, on the panel here, and when I brought it into the C-suite, that was very unusual because most individuals running companies were paying for remediation when it cost a lot less, even 13 years ago. So for the two MDs on the panel, how important is it to foster a new paradigm based upon an engaged healthcare consumer, not one that's atrophied with very little skin in the game, just wants either government to remediate your bad behavior or your illness or your accident, and you got an industry that is based upon the business of remediation. And to me, knowledge and transparency are the two things that have to drive all markets. And then you got to have things like competition, full transparency. From an MD's point of view, what do we do to fix the system from the bottom up before we maybe turn it into a one-payer system out of frustration? And even if the government pays for more, wouldn't it make sense to reform healthcare first, regardless of what we do through nutrition, through USDA? Would love to hear your thoughts each on that.
Okay. And I can go ahead and go first. And I appreciate the question, and I also appreciated in your opening remarks looking at a holistic approach to doing this work. I think from a physician's perspective, at least in my own experience working with tribal communities, and recognizing that I have all of this knowledge about pathophysiology and the understanding of things like diabetes education, one of my biggest challenges really at that ground level was that even if my patients wanted to make healthier choices, they didn't have the means to make those choices or to purchase the healthier foods. So we just have to recognize that each population is different, and we'll need unique strategies with each population that we are engaging. But one thing I do know is that our populations, as diverse as they are, they want to be healthier. They really do. So I think that having a community-engaged approach and recognizing that each group of patients in each population will have their own strategies, and we need to be flexible enough within that. And we talk a lot about evidence-based practices, which are wonderful. As a physician, but also training in public health, I recognize the need for evidence-based practices. But my question is always, whose evidence is it? I mean, if a program worked very effectively in Boston or New York City, it may or may not work effectively in Pine Ridge, South Dakota. So as we're building the evidence base from a physician's perspective, we need diversity in the groups from which we're building the evidence.
And I would add, Senator Braun, so I think your instinct 13 years ago was spot on, and it's spot on today. And it's really clear that we need to reimagine the healthcare system as a preventative healthcare system that pays for value and prevention just as much, if not more, as it pays for remediation, as you put it. And this is happening. This is happening in private healthcare systems across the country are really starting to think about food as medicine, prevention, social determinants of health. But they're doing it in sort of fragmented fashion, piece by piece, bit by bit, learning. And I think the federal government has an important role to play to catalyze this. CMMI's mandate is to test interventions that will improve health and reduce costs. And so I think Congress asking CMMI to really focus on nutrition and prevention and integrating food and nutrition into the system in a way that empowers educated, knowledgeable consumers, gives them systems, resources to purchase healthy food is absolutely the way to go. And I'll give the example of John Hancock Life Insurance in Boston, one of the great and oldest life insurance companies in the nation. About 5 years ago, they launched an insurance program called John Hancock Vitality, which rewarded their life insurance clients for physical activity, for not smoking, and for healthier eating. All kinds of gamification, incentives, rewards for healthier eating, including paying up to $50 a month out of pocket. John Hancock pays up to $50 a month to their life insurance clients for purchasing healthier food. Tufts is kind of their science partner to be sure that everything John Hancock is doing is credible science. John Hancock says we'll spend $600 a year on healthier food for our clients because we'll make money. They'll live longer, they'll be healthier. So that's a model of health insurance for the future. Most of our worksite wellness programs now today will pay for belonging to a gym or even buying equipment, buying tennis shoes or a treadmill. If you get your steps, many programs will give you kind of rewards and other things. We need to do the same thing for food. And so I think your model is exactly right. And, you know, again, CMMI is an excellent place to start. I would hope they would be investing heavily in this kind of innovation testing to figure out what works best.
Thank you. And one final comment. When you've got a podium like this, and for as long as I've been asking the healthcare industry to reform itself, when you've got bad stats like costing 3 times as much as a part of our economy as it did 5 decades ago, that soul searching and looking at how you might do a better job for the most important part of our economy and agriculture and food processing to boot, see what you can do before you're in a pickle to where you're maybe forced by government to do things that you're not happy with. And I especially aim that at the healthcare industry. Embrace competition, transparency, get the healthcare consumer engaged, and maybe less attention will be paid to it through government. Thank you.